For you, those of you who know me, this will not take long. Welcome to all of you on this very special day for Oklahoma's children and their families as we break ground for the Oklahoma Children's Hospital OU Health Behavioral Health Center. As we begin our presentation today, I'd like to recognize several key leaders and lawmakers without whose leadership we would not be where we are today. If you would, please stand as we call on you. First Lady Sarah Stitt. Former Governor Frank Keating and First Lady Kathy Keating. Senator Roger Thompson. Very special thank you and welcome. Representative Kyle Hilbert. Again, couldn't know without you guys. Thank you. The offices of Senator James Lankford, Senator Mark Wayne Mullen, and Congressman Stephanie Bice, represented by staff members here today. And lastly, is there anybody that I missed that we didn't know was here from Capitol? I've got on here Capitol leaders. What is that? But I have just, if you're here, we certainly want to say welcome and thank you. Okay, nobody. So thank you all for your vision and leadership, and now I'd like to recognize to the podium Dr. Rick Lofgren, President and CEO of OU Health.
Well, thank you, Randy. I appreciate it, and welcome to everybody, and really welcome to the groundbreaking of the Oklahoma Children's Hospital OU Health Behavioral Health Center. This is indeed an exciting day for Oklahoma because, as probably all you know, that the care that's going to be provided in this facility is going to change the outcome of some of our most vulnerable children in Oklahoma. Your presence today, particularly on a crisp day like today, really speaks to the importance of this center. As we're joined by a number of important people that really are making this happen, and I really want to take a moment to recognize that there are civic and corporate leaders, mental health advocates, healthcare leaders, and supporters. I want to call out a couple different groups, if you will, and if I call you out, I would ask that you stand so that we can recognize your contributions. First of all, the members of the OU Health Board. Thank you. You'll notice that a couple people may stand more than once. Members of the University Hospital Authority Trust and Board. The University of Oklahoma Regents. We recognize the directors of the various state agencies that are in the audience with us and joining us today. I want to also recognize the Behavioral Health Center Work Group team that really put in countless hours to really make this project come to life. Thank you. And since this is a groundbreaking event, we want to make sure that we recognize the people that are behind the scenes really putting it together. The CM William Brooks, Brockus Payne, and the Canon Design team, which really are, as you've seen, putting together a remarkable, innovative program. You know, the statistics regarding mental health issues for our children are discouraging. 1 in 5 Oklahoma youths suffers from a mental health condition such as depression and anxiety. I want you to have that linger there for a second. 1 in 5. 15 years ago, we would see maybe 1 or 2 pediatric patients with severe mental health conditions that they might consider suicide. We now see that nearly every shift. In Oklahoma, if you will, suicide is one of the leading causes of death for youth between the ages of 10 and 24. The mental health crisis in our community and the youth has been escalating dramatically over the years, and yet the mental health services to meet their needs has not increased. As the flagship academic health system for Oklahoma, OU Health is here to meet that need. Our healthcare professionals are highly specialized with access to advanced treatments and resources that often aren't found elsewhere. Care is driven by research and delivered by multidisciplinary teams who leverage their combined expertise to provide an enhanced level of care. The reality, though, is that many of our young patients with mental health problems need a longer-term and more robust level of care than we currently can provide in the Oklahoma Children's Hospital. That's why this creation of the Behavioral Health Center will help us meet the needs of Oklahoma children and families, many who have nowhere else to turn. The setting will allow us to provide the most specialized care for those patients with some of the most complex mental health diagnoses. Through the generous funding from the state of Oklahoma, we were able to demolish the original Oklahoma Children's Hospital, known as the Charles M. Bilstein Center, named after one of our former pediatricians. We appreciate Dr. Bilstein's family, who are, I think, joining us by live stream this morning, as we continue to honor his legacy. The work is now underway. Construction is expected to last 34 months, and we anticipate the facility will be operational in December of 2026. It can't come soon enough. This behavioral health center will provide inpatient services for short-term stabilization as well as long-term acute treatments. We'll also offer intensive outpatient services where we can provide services to children who don't need or are required to stay overnight in the hospital. Our psychiatrists, psychologists, nurses, and healthcare professionals will deliver compassionate, evidence-based care. The children will also have access to services that are really provided in a children's hospital, such as child life specialists, pet therapy, music therapy, and art therapy to help the healing process. We're grateful to our numerous state and community partners who are among us today, who really are joining us to make sure that the families have the ongoing care and support that they need to manage these difficult chronic conditions. This new behavioral health center is estimated to cost $140.6 million. And to make that vision a reality, Oklahoma Children's Hospital is partnering with public and private entities to help. Several of the public partners have stepped forward with a significant initial funding, including Oklahoma State Legislature, which committed $19.8 million of state general funds and another $39.4 million in federal funds. The University Hospital Trust has also committed another $46.4 million. In total, then, we anticipate the funding from public sources to be $105.6 million of the $140.6 million that are needed, leaving a significant opportunity for private philanthropy. At Oklahoma Children's Hospital, we provide world-class care regardless of the family's ability to pay. But we can't do that alone. As a nonprofit health system, we depend on philanthropic support to really provide the innovative, family-centered, and really important mental health services. We've launched a capital campaign to generate philanthropic support with the goal of raising $35 million. Each donation is significant. By joining the campaign, you will be laying the bricks for a facility that will help all the children across Oklahoma. So I thank you for coming together today to join us in this effort to provide compassionate, advanced mental health care to our youth and giving them a chance for a happy and productive life. So thank you for your support in this mission. It's just so incredible. So next, I'd like to take this opportunity to welcome a leader who is very passionate about the care of children in Oklahoma, First Lady Sarah Stitt, who is serving as the honorary chair of the Behavioral Health Capital Campaign, which she'll speak to in a moment. She is a tireless advocate for mental health issues and for those suffering from adverse childhood experiences. She uses her platform and resources to advocate for those who don't have the means to do it for themselves. So please join with me in welcoming First Lady Sarah.
Wow, this is a really special day. And I know many here in this room thought this day might never arrive. So thank you all in this room that have been working so tirelessly for several years to bring this to fruition. This is a very big deal for the children in our state and the future of our state. Oklahoma, as many of you know, is well known for a lot of statistics that we should not be proud of. And behavioral health and adolescent and pediatric behavioral health is one of them. And as Dr. Lofgren said, the statistics are alarming. 1 in 5 children suffer with really significant behavioral health issues. And yet we don't have the resources within our state, the practitioners, the facilities to fill that need. And the fact that suicide is one of the biggest things on the forefront of our children right now. Every day I hear heartbreaking stories from family members that they didn't know, or they tried so desperately to resource care for their child or their loved ones, and the outcome was something that is every parent and family member's nightmare. And I'll tell you, this hospital and this facility and the practitioners and the science and the different things that are going to go on here is going to break those cycles. We will see a difference in those statistics 5, 10, 15 years down the road. And more than anything, we will see lives that will still be here because of this facility. And every parent, every family member, anyone who's ever known a child that suffered to that extent knows that this is going to make a difference. And I'm so proud of the hard work you all have put in. When they first brought this to me, I had the feeling, I'll tell you, just this sigh of relief, because all of the stories that I hear as I travel across the state from parents and family members trying to resource care for their loved ones and their children. I myself have helped so many people try to resource care. We've had to leave our state. And when you have a child that's suffering and really, really in a bad place, and you go and you're trying to resource care, and your only option is to send them so far away that you may not be able to visit them, that in itself just lends to the layers and layers of trauma that often these behavioral health issues have. And so as a parent and as an Oklahoman, I know that families will have the intervention, the help, the community beside them with the beginning of this facility, this program, and with all of the experts and the doctors and the nurses and all of the different fields that will be brought in. This is going to be a difference maker. And Dr. Lofgren, I just want to thank you for your leadership in this. I know this is a big deal. And I want to acknowledge that the former first ladies in Oklahoma, all parents, all have been here for a very long time. They have really rallied to come around this issue. And I want to thank Kathy Keating, Rhonda Walters, Kim Henry, because they have recognized as well that this is a big issue for our state. And they are my honorary co-chairs, and they are helping leading this fight and raise awareness for this capital campaign. So thank you so much for your help in this. This is a big deal. And as we move forward today, I wanted to bring awareness to the fact that this is not just for Oklahoma City. This is for our entire state. And we know that behavioral health needs, they are no respecter of families or persons. They go across every race, every economic background, everything. So this will be a resource for every family in Oklahoma. This will not just be for those that live within the metro that can get here. This will be a resource for every family in Oklahoma. And our state can do better than what we've done before. And this is a stake in the ground saying we will no longer accept the statistics and the hopeless future that our children have in front of them. And as part of Oklahoma's Children's Hospital, the state's only freestanding comprehensive children's hospital, this behavioral health center will provide the highest level of care, including those with very complex conditions. So often we have counselors and therapists helping us with depression and anxiety in our youth. But as Dr. Lofgren mentioned, we will have the full resources of the Children's Hospital. So many behavioral health issues are very complex, and it's not just a one-stop shop. So this is the great thing about this hospital. It's going to provide resources beyond behavioral health to these families in crisis. And with a fundraising goal to raise and secure nearly $35 million, the Capital Campaign is going to offer great opportunities to philanthropists and families across our state. And we're going to be able to create a significant place in specialized care. And because of the transformational generosity of Oklahomans, we're aiming for the high end of that goal, of course, which is going to allow us to build out additional programs and research which we need. The science and neuroscience behind behavioral health is innovative and changing every day, and this hospital will be a place where we will be bringing state-of-the-art science to behavioral health, which is very exciting for many years to come. And your investment is going to allow us to include private rooms for children and spaces for families to plan their children coming home and their reintegration into their family. This is a big deal, as well as the outpatient care for families. I know as a family member that has resourced behavioral health for many years for my family, a big part of that is when you're receiving that loved one back within your home, it's very difficult, and you need the help from the professionals. You need the touch points. You need the outpatient care to help you reintegrate them into your family in a healthy way that continues their forward movement into their hopeful future. And your support is going to allow this. And it's going to give areas for specialized group therapy, music therapy, art therapy, all of the things that have proven to help children step out of that label of behavioral health, that cycle that they can't seem to break free of. And here at OU Behavioral Health, we will be making a change, taking all of those new innovation things and surrounding families with that support to make a huge impact on the statistics of our state. And I can't forget to thank the generosity of the Everest family. The Gaylord Family Foundation, as well as Devon Energy, have provided huge donations and helps to move us towards our goal. The Presbyterian Health Foundation, as well as the Robert Glenn Rapp Foundation, has also given significantly to help move us towards this hospital. Oklahoma is a caring and generous state, and I firmly believe that there's a bright and hopeful future for our children here. But it involves each one of us taking action and working hard to make the changes that are necessary to see a shift in the statistics of our children in our state. So I challenge each one of you in this room, take this story into your community, into the lives that you touch, and tell everyone about it. Because all of us need to link arms to come together around this project to bring it into really just brick and mortar. So I'm really excited about everyone in this room and the stories that are going to leave here and the Oklahomans that are going to continue to surround this project and support it. It's going to be wonderful. And now I want to thank you, Senator Roger Thompson. I would like to welcome you to the stage. Senator Thompson has been a tireless advocate for health care in Oklahoma, and I want to thank you for your work you've done for many years, and thank you for your help on this project. Please come to the stage.
Certainly a great day to be here today, and I know that the majority of you traveled great distances to hear President Harris speak momentarily. I'll be keeping my remarks short until we get to that sooner than later. I would invite you to pay special attention as President Harris speaks, because in his pre-written speech he'll need some help for some of the big words that he'll be using. Today is indeed a monumental day. This is just really, really good. Over the number of years, as already been alluded to, there's some folks who have been working on this and who have been thinking about this for maybe even generations. But I really do believe that we've had, during this time period, the right people in the right places to come together to make something good happen for Oklahoma. We go back to President Harris. I give him a lot of fits because he deserves it. I mean, there's no doubt about it. But yet for a man to be at the helm of OU with a vision that says we're going to be better tomorrow than what we are today, President Harris is that guy. For the regents who are standing behind him with that vision. When I get over to OU Health, Dr. Loughran, and for Randy and for their team, and for them to invite me to go with them to Ohio almost 2 years ago and tour nationwide and be in Columbus and Cincinnati and see what we could have, and talking to some of the engineers and designers that what we're building in Oklahoma will far exceed what we were able to witness in Cincinnati and in Columbus and at nationwide. And we're doing this not because that we're able to build something better than what Ohio has. We're doing this because we care for our children in Oklahoma. We care for our people in Oklahoma. I'm glad that Governor Keating is here today. Governor Keating is a visionary for the state, has been for a number of years. But when he was governor, he talked about the people of the state, that we could be better than what we were. And there have been times that I picked up the phone, and I've got Frank's personal cell phone. If you don't have it, I'd be glad to talk to you. And there have been times that I've called up and said, Frank, I just need to talk. I need to talk. And I've been to his office, and he said, Roger, don't forget about the people of the state of Oklahoma. Mm-hmm. It's always people. Thank you, Governor, for your leadership. You made it up. You continue to make it up. When I think about former Secretary Corbett, thank you for being here, Kevin. We appreciate you. Under his leadership was we were going to Ohio. Under his leadership, we were going to do this. And I remember sitting in the conference room with him. And it says our children deserve something different than what they have today. And now the Secretary Everest is here, and what a jewel to the state of Oklahoma. Thank you very, very much. You know, whenever I begin to think about children's behavioral health, it's monumental, and I think what First Lady Stitt said a few moments ago is just right on point. But I couldn't help but thinking as we gather here today that conflict is going on in Ukraine. I'm thinking about the conflict between Israel and Gaza and the war that is ongoing and the destruction that we see every day on television. And then I think about children who wake up every day with a similar type of environment going on in their minds. That conflict, that fighting. Last Friday morning, I'm in Okemah, local restaurant, having breakfast. My phone rings. It's a friend of mine who lives in Bristow. And Roger said, I don't know if you heard, but he gives the child's name. He said, last night he tried to commit suicide. Would you go with me to that family? Would you go with me to visit him? Absolutely. Absolutely. This is real. This is needed. And this is now. I am thankful today to be an Oklahoman. I'm thankful today to be standing among giants who says our children in the future will have a better life than they've had in the past. Thank you very much for everyone for what you have contributed to this. And whenever I think about those who have contributed, we would not be standing here today if it were not for the leadership of the Speaker Pro Tem of the House, Kyle Hilbert. Kyle is out of Bristow and just right north of my area. But everywhere I go, they talk about a young man who's making a difference in the state of Oklahoma. And while some of us may be getting closer to the sunset of our lives, he is at the beginning of his life and at the beginning of his professional service. And I'm telling you, if you want to see good things come in the future, you keep your eyes on this young man, Speaker Pro Tem Kyle Hilbert. Come to the stage.
Very kind of you, Chairman Thompson. I appreciate the kind words, and I will note something though, Mr. Chairman. There's 2 events in December of 2026. They talked about this facility will be open, but that will also be the first month you're termed out of office because we have term limits. So be careful what you're saying about President Joe Harris, because when this facility opens, he's going to be able to say everything he's been wanting to say, but he can't because you're in charge of appropriations. So just December of 2026, President Harris will have a list of things to say. But thank you again, Roger, dear friend. Appreciate it. First thing I want to say, and I sincerely appreciate the leadership here, the leadership, University of Oklahoma, the health system, This would not happen without them. But I want to give a special shout out, though, to the people who this really would not be happening but for, and that's the frontline healthcare workers. We've seen over the course of the past 3 years in particular, not that being a nurse or in healthcare was easy prior to 2020, because it wasn't, but we've seen just how challenging that is. And so if any of you are here today, thank you for joining us. Thank you for what you're doing. I could not do it. Every time that either my 1-year-old or 4-year-old daughter has to go to the pediatrician, if they have to get a shot or a needle or blood drawn, I have to leave the room. I can't watch it. I can never do it. But thank you, thank you, thank you. Appreciate it. So for us in the state of Oklahoma, we received $1.87 billion in ARPA discretionary funds from the American Rescue Plan. That there were several different tranches of inflation relief packages that came out of DC, and that was one of them. And so what we did in the state of Oklahoma is really innovative. We actually asked Oklahomans what projects they wanted to fund. I know that sounds simple, but most states didn't do that, but we did in the state of Oklahoma. The good news is we had a lot of feedback from Oklahomans. The bad news is we had a lot of feedback from Oklahomans. And so $1.87 billion is a lot of money. We received $18 billion in requests. And so for us, for Chairman Thompson, myself, our colleagues in the House and the Senate, we had to really dive deep and figure out, okay, how are we going to move the needle? Where are we going to invest these dollars to really make a difference for the state of Oklahoma? So for myself, I served as chair of our Health and Human Services working group focused on this with my co-chair, Senator John Haste, out of Broken Arrow. And during those public hearings, we heard two things loud and clear in the healthcare sector that are just driving issues that we have to address. Number one, I mentioned it earlier, the healthcare workforce shortage. We had to address that, and so that was one of the first things that we did. Number two thing, not too far behind it, if not right there, number 1A and 1B was the mental health crisis in the state of Oklahoma. And what everybody said is, in February of 2020, we had a mental health crisis in the state of Oklahoma. What happened in March 2020 when the entire world changed didn't help and only served to make it worse. And so this is the part of the pandemic that if we don't take concerted effort to address it, that we're going to be dealing with 20, 30, 40, 50 years down the line if we don't make strategic, targeted efforts to address the future of our state. And so that's what we did. And this project is one that I personally am very, very excited about and so glad I was invited to be here today. You know, serving as Vice Chair of Appropriations in the House prior to my current role, Senator Thompson and I spent a lot of time in budget rooms, spent a lot of time hearing from agency directors and various groups asking for money, right, from the state legislature. And most of the time they have an ask. They ask for $5 million, $10 million, and we'll cut it in half, or we'll cut it. This is one of the only times I can think of where somebody came to my office and asked for money, and I said, you're not thinking big enough. You need to go back and ask for more money because of the severe need in the state of Oklahoma. And funny enough, I had no idea. They had the same meeting in a different office a couple doors down with Marcus McIntyre, our health chair in the House. He told them the same exact thing, told you guys the same exact thing. Ask for more because nowhere in the state of Oklahoma do we have a place for children who need long-term inpatient mental health care. Nowhere in the state of Oklahoma. And I've had a constituent, Chairman McIntyre out of Duncan had a constituent as well, who needed that level of care. And it's the most tragic constituent case I've dealt with in my 7 years in office because there was nowhere for her to go. And it breaks my heart to this day thinking about that we didn't have an option nowhere in the state. We tried to connect her with places out of state and it just didn't work. And to a previous speaker talked about it, even if you get someone connected to a facility out of state, now you're talking about separating them from their family for long extended periods of time, which can just make the situation even more challenging. And so for us as a state legislature, this is something that we knew that we had to invest in and was really proud, along with the Senate, when we made the largest single day investment in mental health in the history of the state of Oklahoma with a trio of projects, this being one of them, as well as the new Tulsa Center for Behavioral Health that's going to go in, as well as rebuilding the Griffin Memorial Hospital that's going to be built in Oklahoma City. Those three facilities, including this one, are truly going to be game changers for the state of Oklahoma when you're talking about mental health. we're not just talking about children, we're not just talking about adults, the whole gamut, really targeted investment, and excited about that opportunity and what it's going to do for the state of Oklahoma. And for me personally, I'm excited to be here, and the investment and the people here at OU Children's. My 4-year-old Addison had to have care here, had double hip surgery last year, December 7th, as well as had to have a hip surgery again, follow up a couple months later. And the level of care that the people here, I know I talked about the healthcare workers already, but I appreciate the fact that T.R. Lewis, Dr. Lewis, I was able to text him late at night, hey, we're having this issue, hey, we're having this problem, and he texted me back and worked with me as a parent to help get her the care that they need. And I know that Dr. Lewis and his interaction with me as the father of a patient is not unique. I know that's the level of care that everybody here at OU Health System employs, and for that, I just thank you as a parent, as a father, as a legislator, as a taxpayer. Thank you for the impact that you make, and I can't wait to be here in December 2026 and hear everything that President Harris has to say about Roger Thompson. And with that, I'm excited to introduce our next speaker. Dr. Cowperthwaite has dedicated her career to caring for youth in mental health and behavioral health disorders, and she'll play an integral role in the treatment provided at the Behavioral Health Center. It's my honor to introduce her as Robin comes up and makes remarks. Thank you.
Thank you so much for the opportunity to speak. As you've heard from several speakers today, our children and adolescents in Oklahoma are in a mental health crisis. Children in a mental health crisis who come to our emergency department spend an average of at least 20 hours in the emergency department. So that's average, right? That means many people spend far longer than that in our emergency department. We need a means of connecting kids to treatment more quickly and with the exact care that they need. The new Behavioral Health Center will provide both the expertise and the facilities to treat kids with complex medical conditions. For patients seeking help through our emergency department, we will have an expanded number of specialized rooms that can safely be used for patients with mental health or behavioral health needs. For patients seeking help through our emergency departments, these rooms are quite unique. They are quite safe for anyone with thoughts of harming themselves and have full medical capabilities. As Dr. Lofgren mentioned earlier, we will provide inpatient care for both short-term stabilization and long-term treatment. We will also offer intensive outpatient services and partial hospital programming, both of which provide extensive services without the need of a hospitalization. The facility will also provide a neurodevelopmental unit for patients with autism and intellectual and developmental differences. All rooms will provide parents the ability to stay in the room with their child as they receive care and treatment for behavioral health, a patient and family-centered option not available anywhere else in our state. Patient floors are comfortable, they reduce stigma, and they're designed with common areas outside of patient rooms. And because we recognize that physical activity and time spent outdoors also play a role in the healing process, the center will feature outdoor play spaces on every unit, as well as a 2-story gymnasium and shared outdoor courtyard. The facility is designed with healing in mind and with flexibility at the forefront, allowing for adaptability to meet future patient demands. Finally, our healthcare teams will connect patients and families to a network of community services and resources that will support them after their child leaves the Behavioral Health Center. We are grateful to our numerous state and community agencies and partners, many of whom are here today, and who are joining us to ensure our families are provided with a full continuum of care. The Behavioral Health Center is a 172,755 square foot, 3-story facility. 2 stories will be dedicated to inpatient services, adding 72 beds for both short-term stabilization and long-term care. The Behavioral Health Center will be built atop the new 3-story parking garage and will attach to Garrison Tower, providing easy access to the Ronald McDonald House and Oklahoma Children's Hospital via Skybridge. The close proximity will enhance the ability of our pediatricians and pediatric hospitalists to work closely with the Behavioral Health Center specialists to jointly care for patients with chronic, complex medical issues who otherwise would have difficulty accessing care in the state of Oklahoma. I know 2026 seems far off, and it is especially far away for children and families who need help now. That's why I'm so excited to share with everyone that in order to help bridge that gap and to provide more appropriate space for patients awaiting psychiatric care, we are opening a 10-bed emergency department expansion in February, thanks to the gracious giving of our leaders at the Capitol. So next, I look forward to welcoming on the stage the University of Oklahoma President, Joe Harris, big words and all, right? Who will talk more about how the university is a committed partner in ensuring a vibrant healthcare professionals pipeline that includes mental health care practitioners.
Thank you. It's an honor to be here for the celebration of life of Senator Roger Thompson. It lasted longer than we all thought it would. You have to be honest. So it is. There are these prepared remarks that are absolutely terrific, but listening to what's been said and thinking about how this project has come together, it deserves some acknowledgement, and it deserves a sign from above. They actually put water on you whenever it's time to get off the stage. It deserves to this moment, to me, deserves to be for us to think about it a bit. This project shouldn't come together, right? When you think about it, this project shouldn't become a reality in 2026, and it shouldn't, because forever we've looked at mental health care issues and behavioral health issues and left them in the dark. Right? That's what we've done throughout our history. Right? 1 in 5 of our children have this problem. Right? Among college students, it's 1 in 4 that suffer from mental health issues. Every one of us has either personally suffered from a mental health issue or our family members have. And yet we act like it doesn't exist. We have for way too long. Right? It's no different than a physical health issue, which we treat without shame. So when I look around me, I look at these two buildings, right? These two features of the building, like you see colors that you wouldn't ordinarily associate with mental health issues, right? Bright colors in open and welcoming buildings. And it's not an area that for-profit hospitals go into, or even the free market for not-for-profit hospitals provides. Because it doesn't make money, right? It doesn't function in a way that the market should allow. Right? It's all in the dark too long. If you look at what it takes for this to happen, it's not easy. These are really expensive and really complicated, and you have to have very specialized caregivers to make it work. The first person that brought this to me was Randy Dow. And Randy doesn't get enough credit. Absolutely. And he brought it at a time when we were trying to take OU Health, right, and do a complete restructure. Right? We had to do a leverage buyout of a for-profit hospital system so that we could create OU Health, so we could provide what every state has to have to get healthier. And that's expensive. And it takes a lot of time. It's complicated. And then you have COVID, and you need to make money. So you can do those things that a comprehensive academic health system does that nobody else does. Right? Train the healthcare workforce, engage in the research-based care that nobody else can provide, and treat those citizens that get left out, that no hospital will treat. So when Randy brought this up, I thought, Randy, you don't get it. Right? We need to make some money so we can fulfill our mission. And then Senator Thompson started wearing me out about this. I'd go in to talk about funding for something else, and he'd say, yeah, but what about behavioral health? And I was like, when are you going to term out? 26. Oh, believe me, I know what it is. And the people that have come behind this are just stunning, right? I mean, Representative Hilbert, we came in to ask on a ARPA ask, and the answer was, you're thinking way too small. And it was too small, but we thought we couldn't afford it because people don't support these things generally, right? In all the board meetings, right? State Department of Health, everybody else talking about how we handled this. It's stunning that it's coming together. And then the First Lady gets behind it, right? And says she can help raise the incremental $30 million that we need in the federal level. Right? All three senators, Inhofe was involved as well, Representative Bice. Right? Both of our senators came through and put this together. This shouldn't come together. It doesn't make sense in the market. And we're supposed to hide from this. Right? We're supposed to, because everybody's hid before. And I loved when I walked in here, the First Lady, the first conversation we had was, she said, not let's celebrate today, not what a great job I've done, not celebrating the lead gifts that we've talked about already that are coming in to make this a reality. And my first text in the morning was Rick Muncrief saying we're there for this project. But the first thing the First Lady tells me is we have to work on legislation to make sure that we find ways to keep those specialized providers that we train here in the state and a part of this. Right? That's the attitude. Right? There's an honesty to that. Right? There's an honesty to all of this we don't often see that I think is absolutely stunning and important. And honestly, I would have never dreamed this. Right? I mean, you like to think you're a leader. I wouldn't have dreamed this. I wouldn't have gotten this done. Right? It's the people in this room, none of whom could have done it themselves, that are making this happen and making it happen for families. You know, there's some of us rich enough to go ahead and take our kids out of state. But most aren't. And you think about the crushing impact that happens in your family when you need emergency, inpatient, pediatric behavioral health care. It's a damn crisis that you can't explain and sometimes don't want to talk about. And to take somebody out of state, your life crumbles. And we see kids all the time engaging in suicide, oftentimes successful because they have no treatment for something that is absolutely treatable. Now, I can't tell you, I'm not sure there's a project that I've been a part of. I've been an OU for 30 years. And I've said from the beginning that participation in OU Health and making it successful to help lift the health care of this state is the most important project I'll be involved in my life, in my career. And I can tell you that within that mission, this idea of helping out those that are most vulnerable, helping out children with behavioral health issues, is the most honorable project and important project that I think is inside of that. And I can tell you, the credit for that is across this group here today. Right? This is what we can do. And we got to challenge each other, right? It's like the First Lady, walking in and saying, we need legislation to keep people here. The governor, right, in the state of the state 2 years ago said, how come we've got a crisis where people are dying because there aren't enough nurses? And we got a backlog of nurses that are applying to our schools. That's an honest moment. We weren't doing our job. And so we took that, brought in the Kraken, whose birthday it is, Gary Raskob. And he along with the Dean of Nursing said, how many more students can we take? And across the state, people were dying because there weren't enough nurses to open up the rooms to treat people. And the answer wasn't 1 or 2 or 5 or 10 more, it was every qualified nursing applicant. In the last 2 years, because of that challenge, because of that honesty, because of that commitment, and the legislature stepped in, we didn't even ask for it, and put $2 million more into this. We have been able the last 2 years to take every single qualified applicant to OU Nursing, and we are up 73% in the number of nurses we're bringing in. And that's a product of being honest, right? Not sugarcoating things, not saying everything's okay, because it's not. We know where we stand in healthcare outcomes, and we know what it takes to lift this state and to help people. And so when you're not doing it, call yourself out, right? Call each other out. We weren't providing enough. We're the largest provider of the healthcare workforce in our state. Step up, right? We looked at this and we said, okay, we have all 7 colleges of health here. Are we producing enough doctors, enough dentists, right? Every one of the disciplines we have, and the answer was no. Right? This year, for the first time in over a decade, we didn't just increase the number of the healthcare workforce students here, we increased it by 16%. And we're committed to meeting the needs of our state by providing the healthcare workforce that's necessary, and to your point, First Lady, making sure we find ways to keep them in this state. So it is an absolute humbling honor to be here. We've got so much work to do. Right? There are so many places where we can be so much better and help so many people. But this project is an example that if we can help the most vulnerable with behavioral health issues, right, we can tackle any problem together. So a huge thank you and welcome Dr. Rick Loughran back up.
Thank you, President Harris. It always is entertaining to watch you and Chairman. So I think we all are looking for 2026. No. Listen, I want to thank everybody for joining us today. I certainly hope that all the remarks that you heard really does get you to understand that this is a critical point. This is where we are coming together to really make a difference in the lives of our children, our future of Oklahoma. And I want to thank everybody who has come here today and really start to understand what the importance of this building and the care providers and what we're going to be able to accomplish. We're going to take care of the most vulnerable people in our state, across the entire state. So I thank our leaders of our respective organization, our elected officials for all they have done. I want to make sure that I thank the First Lady and the other First Ladies for really taking their time to increase the awareness and the importance of this issue that has lived in the dark way too long. I mean, this is a major health issue in terms of affecting the vitality of our community and our state. I also do want to take a moment to thank the design team. You're going to see that these are just incredible healing environments, because it does make a difference about the environment in which you take care of these individuals and children. That really makes a huge difference. And I also do want to thank Dr. Raskob, my partner in crime, if you will, as we come together as a health system and an academic health system to bring together both the science, the leadership from the clinical, the leadership in terms of the physicians and providers, as well as the healthcare delivery team, to really make a unique element, bring the science to the bedside, making a difference in the care of our patients today, critically important. So again, thank you, and hope that you get excited about the campaign, because by brick, we're going to make a difference and making a difference now. And so I think at this point in time, we're going to turn a little dirt. So thank you.
So thank you, Dr. Loughran. We have our construction site behind us, and we have a lineup of a handful of photos that we're going to take. I know we have a lot of folks sort of in the back. I'm going to ask that you either step out or wait for our dignitaries and guests that are going to be doing the dirt turning to exit. So our first photo will be Dr. Loughran, President Harris, Provost Raskob, Senator Thompson, Representative Hilbert, Mr. Williams, First Lady Sarah Stitt, and First Lady Kathy Keating and Governor Keating. So if you all can head out towards the back, and we'll guide you around the corner. We have shovels and hard hats. We'll also do, following that, the First Lady's campaign cabinet. Following that, the Everest family and the First Ladies. Following that, we'll have President Harris, Provost Raskob, and our regents. We'll also have a University Hospitals Authority and Trust Board photo, an OU Health Board photo, our executive teams across OU Health and Health Sciences Center, children's leadership, our physician leaders, and our behavioral health work groups. So if you